Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with typhoid and death. When we talk of typhoid fever, we assume that it can kill. Yes, typhoid, especially when it has no antibiotic that could cure it. These days, we are even entering a stage where there are so many chloramphenicol resistance and gluconon resistant typhoid fever. So we are not far from it. But the main cause of death with typhoid it's just the complications. When the typhoid stays too long in the body and is not eradicated or treated, it could lead to what is called bowel perforation or typhoid intestinal perforation, and that I will expose more in the slide section. So when you follow me, you will be able to understand more how the typhoid fever could result in death. But if you like my presentation, press the like button, subscribe, and more information will come your way. Outline: objective, introduction, typhoid complication, laboratory diagnosis, prevention, and conclusions are what we shall be talking about. The objective: to expose the complication of typhoid fever that could result in the death of untreated patients. Introduction: typhoid fever is caused by a gram-negative bacilli known as Salmonella enterica, Salmonella typhi for short. It's periticious, that it has so many flagella surrounding it. The other serotypes are paratyphi A, B, or C, which cause the milder fever. It is ingested in food or water that is contaminated with it and travels to infect the small intestines and then the blood. In the blood, it travels to all the organs of the body and resides finally in the gallbladder. The gallbladder is where it continually being shed in the feces of carriers for years. We need to understand what is meant by untreated typhoid that leads to complications that are life-threatening. When we mean untreated, most times you could take drugs and you think you are treated. No, it is not treated because you have not addressed the main issue, which is the causative organism of that fever, the typhoid fever. Untreated typhoid could be a result of incorrect diagnosis because the febrile symptom is common to so many diseases like malaria, pneumonia, and the rest of it. The drug differs. The drug that you take for that treatment differs for these various febrile diseases. It could also be untreated when the antimicrobial susceptibility testing is not done, and any kind of antibiotic is prescribed instead of the efficacious one. It could also be as a result of the wrong timing of sample collection, as blood culture, the gold standard, should be collected during the first week when the temperature is highest. The organism will perforate the intestine and cause septicemia, sepsis, and eventually what we talk about, death. Let us look at some of this picture. The upmost picture shows the rose spot that is very commonly seen on the abdomen and the chest of people. And when you compare the two, you will see that the typhoid fever tend to have larger rose spots, batches, and that almost makes for a correct diagnosis that the person is having typhoid. Yeah, this is a pictorial representation of the intestine below the stomach, and what you see, those black spots, are the perforations, the ulcers, the serious perforation that will cause peritonitis, internal bleeding that could result in sepsis. So it's very informative that this is what we are talking about. Now, because Salmonella enters its host preferentially through the Peyer's patches of the terminal ileum, the Peyer's patches undergo necrosis and develop ulcerations, hemorrhage, or perforation from the adhesion as seen in this diagram. When you look clearly, you will see the rough edges, the healing point, and the necrosis, the perforations. These are very informative for the complications that it usually causes. This X-ray, plain X-ray, shows part of the complications as the increasing distension of the abdomen. You start seeing the stomach swelling as the patient develop paralytic ileus. You can see the ileum, the region where you can also see the spinal cord and all these in the plain X-ray film. Yeah, the laboratory diagnosis is very important. Blood culture, we know, early is very useful for early diagnosis, at least the first week. And we must take cognizance of the antibiotic abuse, because in the developing countries, you can easily buy these antibiotics. And once you abuse it, it makes it very difficult for the blood culture to be very sensitive for these salmonella. The same thing, stool and urine cultures. After the first week of infection, you could collect that sample. Bone marrow culture remains the gold standard, but it's invasive. Non-specific blood test that we could do is the leukocyte count. Expectedly, the neutrophil is supposed to be low. You are supposed to see neutrophilia because it is moved in the macrophages, just as explained. The liver function test may be deranged, not totally seriously affected. Why that test is more than 100 years old, it's very useful, but it lacks sensitivity when you, at times, it could react to other fever, and that makes it not also very specific for. Though in developing countries where it is very endemic, it is always very sensitive, but the rising titer, that is when the patient has the infection, a repeat test would show a rising titer, which is diagnostic. Newer diagnostic tests are the TYPHOID or TYPHOID, which directly detects IgM, the early antibodies against a host of specific salmonella type. The nestle PCR is also very useful, and all these will help in early diagnosis of salmonella typhi. In conclusion, the prevention is WASH. WASH is the acronym for water, sanitation, and hygiene. I've spoken about hand hygiene, where you wash your hand regularly, but is it in a situation where there is no water in the developing countries, resource challenged countries, where TIP, that is typhoid intestinal perforation, is very common? Effective confirmatory laboratory diagnosis for early treatment is the way out of the complications of typhoid and paratyphoid fever that may result in death. So one should canvass for if they cannot in any way provide potable water, let the laboratory be well equipped with these newer early detection things, the PCR as well as the typhoid, which will detect the IgM in the blood, the early reactions, and that is very, very useful to pinpoint that, yes, the salmonella typhi is what this patient is suffering from before it starts the complication. Early surgeries has always been recommended as well in many work of previous interested workers for internal hemorrhage or perforation, especially in children. If you like the quality of my production, you like what you read, there are so many videos on health matters, and you acquire more knowledge about these things. It helps to prevent, and also you helping others to prevent these health challenges and health problems. The more knowledge acquired is also very useful, if not only for you, for your family, and even friends, those who are around us. The more we acquire this knowledge, the better equipped we are, the better the world is.